The modern healthcare system won't help you heal.
It's designed to keep you sick and dependent on drugs.
If you want to get well, you got to get out of the system.
You found Predictive Health Clinic.
Join us as we get well and stay healthy.
Hey, thanks for being with us, folks. I have today Coach Bronson Dant. I've interviewed Bronson for Dr. Filovadia's show, and I liked the interview. I like him. I think he's got good things to say. So Bronson, welcome to the Predictive Health Clinic.
Thanks for having me, Jack. Appreciate it.
And let's dive in. As you know, this show focuses on one specific health issue, and which is actually the guest's choice. So what one specific health issue do you want to address today?
I want to talk about the issue that I see a lot of, and that is lack of physical independence.
Lack of physical independence. Okay, you're going to have to unpack that for us.
Yeah, just real quick. I mean, basically the consistent recurring challenges that people have in their lives because they're physically incapable of performing in their environment.
Give me some examples.
Walking up and down the stairs, taking care of their dogs, gardening, going for a walk, playing with their grandkids. The things that we look at that we have to say no to experiences because we can't do them. The stories I hear of people who take their parents to the beach or go on vacation and their mom has to sit in the car while they go walk in the woods or go walk on the beach because mom can't make it down the stairs to go walk on the beach with them. Things like that, like those limitations that people have in their lives because they're just not physically able to do things.
Wow. Okay. This is good. So what got you interested in this particular issue?
Yeah, a lot of things. The two biggest ones being my own personal experience of just my journey in general, realizing.
Right, I'm gonna say, I want to circle back around to that.
Yep.
But because this is a wide-ranging and broad problem, what's the biggest popular misconception that you see about this issue?
That it's inevitable, particularly for people as they get older.
All right.
The number of people, right? I'm just getting old. I'm falling apart. I'm over the hill. All of the problems that I have with the aches and the pains and the inability to move and the tightness and the lack of flexibility and the weakness, the loss of balance and coordination. It's just because I'm getting old. And that is 120% not true.
All right. Now this is going to be good to dive into deeper, but let's circle around to your revelation, your moment.
Yeah, my revelation, again, a lot of it's my journey, but it's more about how my journey relates to my experience watching my grandparents as they got older and more frail and bedridden and then passed, and having the majority of my experience and learning that this is not inevitable and learning that there are things that can be done to prevent aging, air quotes, that I didn't know and didn't have in my toolbox when they were in the middle of that. And just the regret and the remorsefulness that I have over not having a chance to make their last days more fulfilling.
You know, it's really interesting. My mom, when she visits a medical doctor, she wants me to come with her because an extra pair of ears always helps. And my mom is 84 years old, phenomenally healthy. And she also has this health issue that hasn't slowed her down in the slightest. The cardiologist has been watching it for 15 years, and it's gotten slightly, barely a little bit more pronounced, but nothing that she can see. It happens to be a situation that it could induce a massive heart attack and kill her instantly. She and I were talking about it yesterday after the doctor, and her dad died from a massive heart attack at, I want to say 76. He was a lifelong smoker. You know, he probably smoked 1 million cigarettes in his life, and he made it to 76 as a very healthy, active man. This was, I guess, 30 years ago that he died. And she and I have agreed for a long time that's the way to go, rather than that long, slow glide into oblivion.
Absolutely.
To be wildly healthy and drop dead.
Yeah. Live
at
as
an
long
old age.
Yeah. Live as long as possible and die as quickly as possible.
And that's what he did. So
Yep.
she and I both agreed that's how we each want to go. So I guess the truth, which is the next question, what's the truth about this issue? I'll let you state it.
Yeah, the truth about the issue is it is absolutely possible to be physically independent at almost any age.
Man, I'm sitting here regretting how tight I want to keep this show because this is good. But I've got to promise to my audience that we'll
Sure,
keep it
sure.
tight. And probably what we're going to do then is we're going to circle back around and we're going to have an extended conversation that will be, I don't know,
Do like
something
bonus material or something.
bonus material that I
There you
don't
go.
actually do on this show, but maybe we need to. All right. So let's talk about the likely outcome if people do not take some kind of
Yeah.
action.
Pain, death. Death is going to happen anyways, but pain and discomfort before you die. Extended, long, drawn out, and unavoidable. Loss of freedom, fear, shame of forcing others to take care of you. Just in general, the lack of autonomy and independence that every human being needs to survive and thrive.
Really like how you framed this. I mean, this is going to hit a lot of people where they live. Man, this is all right. I would like to, for our listeners, I'd like our listeners to know that Bronson and I are doing this interview about 2 hours after Robert Kennedy addressed the nation and said that he believes that the massive decrease in the health of American citizens just in the last generation is the single biggest emergency
Absolutely.
that our country faces.
100%.
So it's kind of cool that I had no idea that this was going to be what you were going to talk about.
Mhm.
But for my audience, as you're listening to this, it'd probably be about a month from now. That's the day this is happening. So I know over the next month, this issue is going to become more and more prominent in the public consciousness.
Yeah.
None of us wants to become a drain on our loved ones and lose our independence and lose our autonomy as we get older. So let's get down to brass tacks.
Yeah.
Specific actions that we have to take to maintain our independence, or even better, regain our independence if we've lost it.
Anything you possibly can. Do it. And that's literally it. Because I can't give a specific action other than do something more than you're doing now. Because everyone comes from a different place. If I say walk 10,000 steps every day, what if someone can't walk? If I say start sprinting, well, what if someone can't sprint? So I can't give a specific action, but I can say your body will adapt to anything you make it adapt to. If you want to get better at walking up and down the stairs, start walking up and down the stairs until it becomes easy. If you want to get better at playing, getting on the floor and playing with your grandkids and getting back up off the floor, practice getting up and down off the floor until it becomes easy. So the best way immediately improve your quality of life and your ability to engage in your environment is to start doing the things that are currently hard.
Sure, that makes sense. Because of the work that I do with Dr. Ovadia, and I get to talk to these smart, healthy people all the time, I ran into something that talked about squatting, not powerlifting, putting weight on your back, but literally just squatting down to the floor, something that apparently humans did for hundreds of thousands of years before we invented chairs.
Yes.
And so I said to myself, I should squat. And I have these very clear memories of being a kid, from being, a little kid all the way up through teenagehood, going somewhere and squatting down and just being in a squat position for a long time.
Yeah.
And then just bouncing up. And I tried it and I went, oh my God. I was so tight. It hurt. Everything about it was unpleasant. But because I believed it would probably help me, I continued doing it. And it wasn't really that long ago. And, right now I can do a nice sit down on the back of my calves squat with my feet flat on the floor and stay there for a decent amount of time without being horrendously uncomfortable. My point is that it seemed like such a simple thing, but it was not fun. It was not pleasant. And I have experienced for myself, oh, just push a little bit and your body adapts. And my body adapted. It was pretty cool. It was pretty fun.
This is exactly how it works.
Do you have any cool stories as a coach? I'm sure you do. What are some of the stories that jump out to you?
Oh my gosh, I've got tons of them. I always like using my mom as my example whenever I talk about stories, right? So
Yeah.
I started working with her one-on-one when she was 60. And just to shorten up the story, she just turned 70. She uh, works out regularly. She still works a full-time job. She's a president of a private school. She built during COVID, she built a gym in her basement. She loves to deadlift. She loves to squat. She loves to, work out. She hates burpees, but she still does them.
Okay.
When I tell her
nobody likes burpees.
Yeah, nobody's like burpees. But yeah, I mean, her story of being over 60 when she started, and the reason she started primarily was to reverse osteoporosis, which she did.
Wow.
She no longer has osteoporosis, and she did that. A majority of it had to do with movement. She changed her diet, started increasing her red meat intake, and just making a lot of general changes, reducing inflammatory foods, making a lot of general changes that when she doesn't work out, if something happens, she gets off a schedule, she gets busy at work, and she can't work out, she's not the same person. She needs that physical activity to kind of keep her sanity and to kind of remind her that she can do things. And that's another aspect. I know we don't have a lot of time, but the physical stress of working out when you're doing it because you're committed to your goals and you want to improve something about your life makes the mental stresses that life puts on you that you don't have any control over, makes it easier because you're practicing the process of managing stress on purpose.
Oh, I'll be frank. I've never heard anybody frame it quite that way.
Yep.
Intentionally making yourself do things that are physically difficult. Intentionally making yourself do things that are physically difficult trains you to manage stress that you can't control.
Exactly.
Am I understanding that right?
That's pretty much it. Yep.
Wow.
You're just building habit. You're building
a mic drop moment.
Yeah, you're building a habit loop. You're building a pattern. You're building a response system that you're in control of. So when you're not in control, when something happens you can't control, you have an automatic response to how you're going to manage it.
That's probably blindingly obvious to everybody but me, but that's literally the first time I've ever thought about how that works. I mean, everybody knows, hey, if you're feeling stressed, go work out and you'll feel better. But I hadn't thought about the intentionally subjecting yourself to physical stresses trains you to develop an automatic response to stress you don't have a control over. I think that's brilliant.
Yeah. And that's where the whole idea of body confidence and trusting your body. And, when you see someone who's in shape walk into a room, we automatically think they're confident because they look good. No, they're confident because they've worked for that. They've done hard things. They know what they can handle if something goes sour. They don't have to worry and be anxious about what could happen. They know they can deal with it. That's where the confidence comes from.
Your website talks about mindset, and it hits me now. That's what's happening between your ears, in your mind.
Yes. Yes.
Wow. Okay. What's the most common compliment you get in your practice?
That it's the most common compliment would be that it's proven concepts that I really try to focus on giving a broad range of tools for people that are based on concepts, not protocols. And it allows individuals to pull the things that they need that apply to them without just trying to do everything under the sun and do all of the things that everyone says is best.
Give me an example.
Right? Because it's the concept of nutrient density that's important. You can get that a lot of different ways. For somebody, nutrient density may be stop eating potato chips at lunch and just increase the amount of meat in your sandwich. they're going to increase in nutrient density. For some people, it may be, hey, you're eating a lot of oatmeal for breakfast. Let's stop the oatmeal and start eating some eggs. Right. So the way that people implement the concepts of health and fitness and mindset is what I focus on, because everyone will implement it differently. But as long as they're hitting that base goal, what's that base requirement that I need to move forward, that's what's important.
This makes a lot of sense. Okay. Most common complaint.
That it's hard. Because
Bronson, this is not
right?
easy.
Here's why. Not because it's hard to do anything, but because the core of working with me is about changing how you think about what you're doing. I can give anybody a fitness plan. I can give anybody a nutrition plan. If you're going to do it consistently and understand that you need to do it for the rest of your life, is a whole different discussion. And there's a lot of limiting beliefs, things that we have been taught for years that we have to retrain our mind about what it means to be healthy, what good nutrition is, what good fitness is, all sorts of different things that have to be rewired in the brain in order to get to the next level. And that's the blocker for 90% of the people.
This is good. All right. This is my favorite part of the show. Question 9. If you could deliver just one message about health and you only had 8 words or less in which to deliver it.
All right.
Those 8 words.
I'm going to go over 8 words, but it's one sentence. I'm going to reframe the requirement. Body confidence is the freedom to engage in life to its fullest because you trust your body to perform and protect you.
One more time.
Body confidence is the freedom to engage in life to its fullest because you trust your body to perform and protect you.
I'm a marketer in real life.
Mm-hmm.
I think we can improve that.
Sure.
I do. I think we can improve that. And I'll tell you, the reason for the 8-word limit is very simple. A lot of my clients are locally owned, locally operated businesses. And so our job is to make them popular and famous locally. And one of the ways that we do that is with billboards. Billboards are a support type of advertisement, not a primary type of advertisement. People screw up billboard advertising all the time because they put too many words on it. The absolute maximum number of words you can put on a billboard and still have it accomplish anything is 8. So I want to come up with a billboard for Coach Bronson.
Sure.
That still delivers it. All right. This has been the Predictive Health Clinic. Bronson, how do folks get to know you better?
Yeah, super easy. Just Google Coach Bronson and all my stuff comes up. CoachBronson.com, Coach Bronson on YouTube, Coach Bronson on Instagram. I do have a new book on Amazon called Body Confident that comes out in a couple of weeks. So you can look for me there as well.
All right. We'll make sure all the contact information shows up in the show notes. Thanks for being with us. We'll talk to you next time.
Are you a healthcare practitioner eager to escape the grind of corporate medicine?
Are you ready to make a massive difference in your world? Listen up.
We are the Wizard of Ads.
For 40 years, we've created dominant brands in a variety of industries.
Now, we're bringing our magic to healthcare.
We're seeking one extraordinary healthcare practitioner to help us build the first national brand in direct primary care.
If you think you could be that person, let's talk.
Email us at health@wizardofads.com.
Tell us why you think you're the one.
That's health@wizardofads.com.